Hi, my name is Cornel Grey. I am a postdoctoral fellow at the Dalla School of Public Health and an upcoming PhD graduate from the Women and Gender Studies Institute. My research really came from a place of frustration at the time based on where I was in my doctoral study, and I was seeking connection in a space that wasn't really able to grapple with Black queer life. And so I started to think about the nature of how Black queer communities operate as well to maintain care for each other. I wanted to think through how certain practices of care, some of the ways that Black queer communities negotiate risk and seek out pleasure. A lot of the times these are described as risky or pathological behaviors, and so I really wanted to do some more work in to kind of offer a different kind of narrative about why Black queer men make the different kinds of decisions that they do in order to maintain their health and well-being. My doctoral project starts with interventions in public health, specifically some of the work around HIV to really think about how skin-to-skin contact has been imagined and talked about when it comes to Black queer men. So Black queer scholars recently have been talking about how public health imagines the Black body, the Black male body, Black blood even, Black semen even, as a danger to public health. And so skin-to-skin contact is demonized in certain kinds of ways. On the other hand, the same body of literature also talks about particular benefits of skin-to-skin touch. So, it improves heart and health, lung function, it decreases stress levels, it increases our capacity to bond. And so the project is really thinking about some of these tensions where, on one hand, skin-to-skin contact provides a certain set of health benefits, but on the other, there's this narrative that Black women aren't supposed to touch each other. And so the dissertation project really kind of grapples with those two tensions and looks at some of the literature that documents the experiences of Black queer men, particularly within the context of the 80s and 90s HIV/AIDS crisis, to think about how did Black queer communities advance models of care and intimacy and pleasure within public health crisis in ways that might perhaps be vilified by official public health policy. I also wrote the dissertation within the context of COVID, and so there were similar themes emerging around public health guidelines promote or suggest a particular set of practices, but people also but some of the strategies that people were using to kind of get through the pandemic also required a certain degree of risk, perhaps. One of the things that we found, which perhaps might be self-evident in some ways, was that queer communities actually have a robust history and a rather high degree of competency and innovation in how we respond to public health crisis, because the HIV epidemic is very much still ongoing. And so the participants we spoke with, we found that so much of their sexual life, yes, but social life, their networks, their community, their access to community was disrupted within the context of COVID-19. We also know that for many queer people, relationships with family might be complicated for a number of reasons. Many participants lived alone, and so even though COVID-19 teen prevention measures were promoting isolation and quarantining and social distancing. And I mean, this had quite significant impact on the mental health of the men that we spoke with. People were also trying to carve out strategies to ensure that they had access to connection and contact within the context of the first lockdown as well. I'm just even thinking now about how some of the participants that we spoke with are having conversations about vaccination, even as a way of kind of like mitigating COVID-19 risk, like having conversations with your partner about risk and so forth. Some people have adopted strategies in terms of wearing masks or not engaging in particular kinds of sexual practices. But what we did find for sure is that connection, access to community was like very important for members of the queer community, particularly for those whose lives and identities aren't affirmed or supported by like family, for example, right? Like oftentimes, being amongst other queer people is the only space in which some folks feel really supported. So that was one of the important things we kind of came across. The COVID-19 pandemic is still very much real. And so it's hard kind of thinking through like how to create spaces that people can get together in person. I mean, one of the things that I did earlier on that I'm kind of like working through how I might be able to go back to that is I had started a podcast with some friends of mine about the queer experience, and that was a kind of like fun and exciting way for us to talk about what life is like specifically for queer Caribbean folks. We shared some of our experiences in terms of how we were kind of like getting through and navigating COVID, including virtual forms of connection. As we're moving into the 2022 summer, I mean, hopefully there'll be more opportunities to connect with folks in person, be that at Pride or otherwise. But yeah, certainly I'm still trying to think through or like work through questions of safety as far as next steps are concerned. One of the things that I'd say is to really find a supervisor or a mentor who not only understands your vision and where you want to go in terms of your career, but someone that can support how you want to go about that process, right? Like sometimes, we might find a supervisor that understands or supports like what the project is, but aren't necessarily on board with like how we want to pursue a particular project. And as Black queer scholars, working with Black and queer communities, we have a certain kind of commitment to the communities that we're doing work with. And so making sure that you're able to surround yourself with a team of people who are able to support and celebrate that vision, I think is really important.